Thank you. I hope you will allow me to talk while I'm seated down. But I would like to recognize the two principal directors that are here, Dr. Mklanga on my immediate left and Dr. Makarau on the far left to me, but also the two people who are in prevention, Dr. Manangazira Poshia and Dr. Piri. But on my right, we've got the UNICEF boss here in the country, Dr. Ayer, and on his right, we've got Dr. Juliet, who is the country representative of WHO in an acting capacity. And we've got also Dr. Chimsoro on her right, who is in the WHO offices. This statement is really to cover what has happened over the past few days. And it is important for us to, as a country, to be aware of what is happening and to make sure that our country is not put in a state of panic or that we are alarmists, but at least we want our populations to know what is happening. I'm aware that on Friday we were at a function where we were receiving some equipment, laboratory equipment, and that's where we found that there is an outbreak in Chegutu, and after that function around 2:30, we drove over to Chegutu. So a cholera outbreak has been reported in Chegutu municipality in Mashonaland West Province, and this was on the 18th of January this year. To date, there are 32 cases, 30 suspected and 2 confirmed cases, and 4 deaths reported. There has been several reports, one saying 5 and another one saying 4. But I'm aware that in terms of epidemiological studies or linkages, the 4 deaths are the ones that we are talking about. The 5th one was of a child who also died around that time and was not necessarily associated, isn't it, with the current epidemiological linkages. And we think that the index case, when we say index case, we mean the first case, was an 8-year-old female who succumbed to the disease at home on the 8th of January this year. Subsequently, people who attended this funeral and other subsequent funerals linked the initial case, and people fell ill and started presenting for treatment at the hospital. We did a cholera test on the 19th of January on one of the deceased, and it confirmed cholera. The type of cholera was called Vibrio ogawa. 2 other samples tested positive for cholera and were confirmed at the National Reference Laboratory. Now, Chegutu Hospital, where the cases are being reported, as of today, first there was 1 case on the 12th of January, 3 cases on the 13th, 5 cases on the 15th, 3 cases on the 16th, 1 case on the 18th, and 4 cases on the 19th. The last 2 days, only 2 cases were seen in the hospital. And today, as I speak, there is only 2 cases in the hospital. In all, 19 males and 15 females have been affected. It is very critical to note that all these suspected cases are all linked to the funerals that occurred in the locality. But Chegutu municipality has a critical shortage of water due to aging water reticulation infrastructure like most towns in Zimbabwe. And this needs to be addressed, and needs to be addressed aggressively. There is a rampant vending in undesignated places, including selling of meat and fruits on pavements. People buy and eat all these on the streets in unhygienic conditions, putting themselves at risk of cholera and other diarrheal diseases. People should desist from eating foods cooked or prepared in unhygienic conditions. We encourage people to practice good hygiene practices, wash hands before eating food, wash hands after visiting the toilet, and wash hands after changing nappies. Drink only safe water, which should have been boiled or treated with the appropriate treatment chemicals. Let's avoid big gatherings during outbreaks such as these ones. And let's not shake hands at these gatherings of funerals. I'm aware that it is our culture in this country kubata maoko, and literally kubata maoko. But in these circumstances, please, let's try to avoid shaking of hands. We had now a gesture where we either shake on the elbows or and do our fists. It's very, very important because you really minimize transmission of the Vibrio cholera. In the event of death in the community due to cholera, this should be supervised by health workers. We are aware that in this particular case, when this old lady died, people who did their rituals washed her with bare hands, and they are the same people who subsequently died. And some of them who subsequently came to Chegutu Hospital are the ones who were carrying her in the blanket. So the source was really there. Action taken so far includes that we have put all our provinces on high alert for cholera. In other words, the country has been put on high alert for cholera. The District Civil Protection Committee has been activated in Chegutu, and meetings are being held twice a day and are chaired by the DA to tackle the cholera issue. When it is cholera like this, it's better to involve everybody, not just the health sector, and the DA is very appropriate to chair these meetings. The Provincial Rapid Response Team, led by the Provincial Medical Director, Dr. Nyamayaro, is on the ground to render support, and this has been happening since the 19th of January. The National Rapid Response Teams have been conducting a cholera assessment in the province together with UNICEF and WHO, and they are on the ground to support the district and the province to deal with the cholera. I myself have visited the area. Like I said, the very first day, I went there and I followed it up again on the 20th, the second day. I was in Chegutu almost the whole day. And we've had meetings with the DMO and his team. And when I went that time, I went with the WHO. We convoyed there and told and saw the patients admitted. And we actually visited the patients admitted in the treatment ward and went to the locality where the cases are emanating from. A treatment camp has been set up closer to where the patients are coming from, and this has been set up at Chinengundu Clinic in Chegutu. Health education campaigns through the IEC distribution and door-to-door visits are being done, as well as SMS messages on mobile phones. It is important because people who came to the funeral, because there were a funeral, a religious group, a machawa. A lot of them, some of them did not come just from Chegutu. They came from, we heard that there were addresses from Mavuku, addresses from Epworth. So it was worrying for us, because those then, if they go to Mavuku or Epworth, they become seedlings for cholera if they've contracted it themselves. That is why for now, the whole country has to be on alert. And also, although the cases are coming down, we are still very, very conscious of the fact that some may still be incubating the Vibrio. So we need to keep on being on high alert. supervised burials being done and prohibition of consumption of food at funeral gatherings and shaking of hands. Active surveillance, including contact tracing of persons who attended funerals of the cholera death being followed up in Harare and other areas. So the teams went, fortunately when our teams went, the funeral was not over yet. So they were able to give messages to those who were at the funeral and alert them towards the cholera danger. But I also managed to get to know that some of these were not coming from Chegutu alone. We want a control of food vending in undesignated areas, and this should be enforced, including the inspection of appropriate funerals. But it is also important to note that there has to be something done at the borders, as has been mentioned by Dr. Mhlanga, that Zambia is, we're twins, and there's a lot of movement, a lot of traffic between the two countries. And at Chirundu border post in the Urungwe district, orientation of health staff, nurses, and port health authorities has been done. A task force composed of clinic staff, SADC health post, council and port health staff was set up and tasked with coordination of cholera activities to conduct surveillance, cholera activities, conduct awareness campaigns at that entry point and also in the residential areas. There's been at Chirundu, because of the high volume there, we advise that they set up a cholera treatment camp just in case something happens there. Strengthening of refuse collection from 1 to 3 times a week by the Chirundu local authority has been instituted. Council has made sure there is uninterrupted water supply. I think this is key. When you have a cholera outbreak, please give safe water. Otherwise, the situation just becomes unpredictably critical. Council availability of toilets and piped water at residential stands, and screening of imported food and food in transit. And clearly there's need for very strong cross-border collaboration between ourselves and Zambia. And we have pre-positioned a lot of medical supplies so that we've got the appropriate drips, the appropriate ciprofloxacin, a drug that we use, and we also have the giving sets, the taps, so that at least from the medical side, there's nothing that seems to have been in. We do need, of course, some more gumboots, some aprons for cholera in these emergencies. And I know that there was a very big meeting here where we said, let all the donors come, let all the NGOs come who are in this area. And we wanted them to know that we do need some of these things. We need some of the consumables. We need to continue with IC materials. I see some of these here. And also, importantly for us, was to respond at Kariba. Orientation of health staff has been done. Refuse collection is being done once a week. With enforcement of food safety and setting up of a tent at the border post. So these are areas that we have looked at, and I think that you must recognize that it's a twin problem, cholera and typhoid. We have been having typhoid here since October, particularly in Mbare, in Harare, but it has spread to a lot of suburbs. Typhoid is slightly more manageable than cholera. Cholera is a real killer. You contract cholera, you have severe watery rice stool type of diarrhea, which is almost unending. You will not urura chaiko. And then you become very dehydrated, no water. And that's what kills you. That's what exactly kills. So you need to replace that water urgently. Some of the patients were having 2 drips at once and flowing fast to make sure that they are rehydrated. So cholera, to us, within hours you can demise. And so I think it's something that while we are not setting or putting people to frighten people or make them panic, but it is important that people are aware that cholera is a killer. So I think we end there, Dr. Mhlanga. That is the briefing we have for now. Maybe my colleagues here may want to add one or two other things. That will also be welcome. Okay. Thank you.
Okay. Okay. Thank you very much, Honorable Minister. I think before we get to question and answer session, I will ask WHO as well as UNICEF to also give us some brief comments on the epidemic.
Thank you. From the perspective of WHO, perhaps I'll talk briefly about the regional perspective in reference to cholera. Currently in the African region, we have 12 countries trying to respond to the cholera outbreak. And some are advanced stages in terms of being able to control the outbreak, and some countries are still struggling. For example, Zambia, our neighbor, is still struggling. We've also seen marked successes in reducing the outbreak in Kenya, in Malawi, and in Uganda. So, of course, as WHO, we bring in lessons from these countries where we've had successes, and we bring them to see how we can support the response in Zimbabwe. But perhaps I'll say that we really appreciate the efforts put in place by the Ministry of Health. They are well in line with the guidelines of WHO, and I think we see the results that not so many new cases are being reported now, and we are in full support of the Ministry of Health efforts. Where we've had challenges in some countries in the past is weak political leadership of response efforts. But I think here I want to note that the minister himself has been on the ground to see what's on the ground, and he has been involved in the response efforts. And as WHO, we are working closely with the Ministry of Health in response efforts, strengthening surveillance, improving case management. And I think a week ago, we were at a function where we donated some kits. Some of them were diarrhea control kits to really beef up the preparation in case an outbreak comes, because we are aware of the happenings in Malawi and the happenings in Zambia. So that we did well ahead of time, and some of these supplies are coming in handy to support response efforts. So I think I will say that, and to emphasize that we really approve of Ministry of Health efforts. And we are working close with the Ministry of Health in the response efforts, drawing on to our capacity within the organization, the country level, the regional level, but also our headquarters, to bring in technical expertise, but also resources in areas where we're able to, for example, surveillance, we are supporting that strongly. Also training of our health workers, we're supporting that strongly. Issues of data, because we need data to study the trend of the outbreak, we're also supporting that strongly. Thank you.
Yes. Thank you very much for being here, and thank you, Honorable Minister, for also inviting us to this press conference. I just want to emphasize what the Minister has said, is that cholera is actually a killer, and it's really a big killer. But the good news is that when someone has cholera, when he seeks treatment very early, the chances of saving that person is extremely high. So I think as journalists, as press professionals, one thing we will ask you really to help us with is to get that message out there, that when someone is feeling that he has or she has cholera, please seek treatment immediately, and your chances of being saved are extremely high. I also really want to appreciate, Honorable Minister, the reaction, quick reaction, and the leadership of the ministry and the government for recognizing the issue very quickly, because in many cases, what happens is that the government denies the problem, and then we only get all together to fight it when it becomes very difficult. So by doing this, Honorable Minister, I think we have really taken the right steps to make sure that we are all together going to address this issue very quickly. The minister has always stressed the issue of water access, hygiene, and sanitation. Cholera is indeed a disease that is caused by that kind of poor access to water, hygiene, and sanitation. So, again, here is an opportunity for us really to make sure that you, again, as professionals, get that message out there, as the minister said, of really taking these issues of having access to clean water, hygiene, and sanitation very seriously in areas where this is an issue. And to end, I know there are many areas, even here in Harare, the minister has talked about the issue of typhoid in Mbare. Today, we also want to really make sure that we all together do everything we can so that it doesn't reach those areas, because if it does, it may become even difficult to tackle. We were talking with my colleague from WHO and the colleague from the ministry right now before the minister came about the possibility of us also thinking of maybe Honorable Minister having a vaccination going on in those areas which are very risky, to make sure that at least we protect people in the coming weeks. So the colleague from WHO will take the lead on that. She will consult with the regional office, and then of course we will be all there to support your effort as we go through this.
Thank you very much. I think at this point we will give colleagues the opportunity to raise any queries or any areas of clarification insofar as the cholera outbreak is concerned. So you can, by show of hands, if you want to ask a question, just state your name and the organization that you represent.
The financial resources, how prepared are you as this for the government?
It's a difficult one. You know, the health sector still needs a lot of money. We need money from, you know, these things are all linked together. We cannot isolate cholera and so on. It really pervades other things. But I think within the context of cholera, we've been able to get a lot of support from our colleagues from UNICEF. When I went there, you had given us these tablets.
Yes, aqua tabs.
The aqua tabs. The water guard, I think, came from somewhere else. Yeah. We also got something from MSF. So in terms of, and who else? Agro. Who was the other one? German Agro
Action.
The Action, yeah. So we got a lot of all these partners who say to themselves, well, let me try this, let me help you here. And this one's say, let me help you here. So for now, I think within the pace of cholera, it's been covered. But clearly, your question pervades other areas. But I think investigations are still continuing.
Yeah.
To really see kuti ambuya wakaibata sei vega vega zvakabva kupi. I think it will give us a lot of consolation to know exactly where this came from. Just herself and not spread from. It's really important to find out.
Yes. Minister, what's your message to the local councils, especially Harare, with regards the quality of water, not really the availability, because in Harare the water is there, but the quality is very poor.
You see, water that we drink should be potable, it should be odorless, it should be colorless. And what we are finding in some cases is that water has got color, has got odor. And my message to the city of Harare is that really they must up their game. It is unacceptable that we continue to have water of that quality. What is important, however, is that they test their water. They've advised us that the water you must boil. So we do urge people that they boil their water. Boil the water, because you see, the pipes in Harare, some of them are rotten. So wherever it's rotten, although the water is passing, it seeps.
Yeah.
It can seep bacteria through that. So let's be safe as much as we possibly can. Let's try to boil our water. But there's a strong message, not just to Harare, to all local authorities. They really must. I mean, it's just not water. It's also the issue of sewage disposal. It's a very key issue. The issue of waste management. Just tsvina iri mumacity isiri kutakurwa. The issue of vending, it's a big issue, especially if it's illegal vending, and you find mangoes dzakaiswa pa street, and you buy it. Some people don't even wash and start eating, and with this cholera, it's just scares us. So our message is really, let's get our house in order. And the problem with cholera is that even if the health system will treat, like you are saying, we see people and we treat them, but as long as the cause is there, if the cause is there, then we'll still have that problem. At the back of my mind, when I'm sleeping at home, I know that I can be phoned anytime with cholera, because I know that mvura ichiri kunetsa, waste management ichiri kunetsa. Ukaenda kumatapi, mvura yesewage iri kudururwa kubva mumaflats. And I know that you just keep your fingers crossed, and it shouldn't be like that. In the end, everything people say, you're not Minister of Health. But unfortunately, the problem is created elsewhere. And when we end up to cope with that, it really irritates, it annoys, it's painful. So that is the issue with cholera. That is the issue with city authorities. It should be upped, this game.
Minister, do you think we are doing enough as a country to address possible causes of this epidemic?
We are not doing enough. I don't think we're doing much at all. I think it should be prioritized. You know, if you don't prioritize human health, tinoramba tichingoshorana, health. But it's a question of financing, it's a question of prioritizing, but we need to uproot the system and put something that works for the people. We should be able to have chemicals out in the. We know that our budgetary constraints are paramount, but there we are. It has repercussions on all our health, all of us. And we will continue to say health, but this is the problem. And you can't afford, it's cheaper to prevent, always cheaper to prevent than to treat. Okay.
Yeah.